Hey everyone, I'm back doing EVD, but now I'm going to talk to you guys about how to attach your EVD to the pole, level it, zero it, and then use it for basic maintenance of your patient monitoring ICPs. All right, so on the back of your EVD, there is this large triangular shaped piece. When you push it, what it's going to do is it's going to open up these, I call them teeth, so that they will hang on the pole. So this is like so, when I push it, it comes away. So this is how you'll get it around your pole. You're gonna want a singular pole, nothing on it, not attached to the bed. It just makes it a lot easier for you. So I'm going to push on the back and I'm going to latch this around my pole like so. I do not secure it anymore at this moment because it's not level. I don't know if it needs to go up or down the pole. All right, now I'm gonna take that level that I attached in video 1, and this is what I use to determine where it's level. So you guys remember that we're gonna level the EVD to the tragus of the ear. This is a little front flap on the front of your ear. So I'm gonna take my level to my patient's tragus, making sure that this string is taut, and then I'm gonna go up and down the pole. So for this patient, for example, we need to come down quite a bit in order to get that bubble into the center of my level, okay? Kind of difficult to see on video, but that's what you'll be doing, all right? Once it's level, I'm gonna leave the EVD exactly where it is, all right? There's a little hook in the back that you can hang this on. Anytime your patient moves their head, that has to get re-leveled, okay? Now I know that this belongs right here on this pole. You can secure it more tightly to the pole. One thing is that there's gonna be this very long drawstring, goes up to your IV hooks, tighten it down so that if this were to fall off, at least it's at the right level. There's also these little rubber bands, and behind the pole, there are these little teeth that they fit into, like so, for both the top and on the bottom, okay? You are attached to the pole, you're ready to set up, we're ready to be using for patient care. First thing that we're going to do is notice your stopcock. All right, I need to zero this. Anything that I have a transducer on, you gotta do two things: level it, zero it. Anytime the patient moves, anytime that you're concerned about the readings, level it and re-zero it. To zero your EVD, we always turn things off to the patient. So if you guys remember from the first video, this bottom line here is the patient. This top here is gonna be your drainage. I already have it off to patient because that's how I primed it. So off to patient and just hit 0 on your monitor. You're zeroed. Once you see that flat line for the ICP, you know that it is zeroed and you're good to use your EVD for monitoring. All right. Look at your orders. Your orders might be close the drain, open the drain, and then you'll also have a number of where to drain it at. I am going to drain this patient at 0 centimeters of water. Completely appropriate, right? How do I open this up to drainage? Okay, this is drainage, this is patient, this is the monitor. I'm gonna turn it off to the monitor to drain the patient. So when one thing is off, two things are on. That's how I have to repeat it in my brain. So if I have this monitor off, I am draining the patient, right? If I turn my drainage off, I am monitoring the patient. All right, so that's how you would get an ICP. Basic maintenance of these. Once an hour, I need you to get an ICP reading. I need you to calculate a CPP, and then I finally need you to come down here and look at how much CSF and blood output you have, okay? So 3 major things that you're always gonna do once an hour. Monitoring an ICP. So let's say that I am sitting here and I'm draining this patient, okay? So I'm draining the patient. Oh, it's my hour, I need to monitor my ICP. You're gonna flip this stopcock up to the drain and you're gonna monitor the patient. On your waveform, you'll get your good wave, you'll get a number. 0 to 15 is normal. Anything over 20, we're gonna have to do something about. And then calculate a CPP. CPP is MAP minus ICP, right? You want it to be above 60, okay? So these patients might have an art line, and you're gonna look at their MAP, and then you're gonna get their ICP off of your EVD. And then finally, coming down here, I'm gonna look to see what my output is. Now, of course, I know this is saline from my flush, but let's pretend it's bloody, has a different consistency. I'm gonna look at that and I'm gonna say, okay, I've got 4 cc's of output from my EVD. I'm gonna mark that in my chart, and then I'm going to turn my stopcock like so to allow that fluid to come down. Don't forget to turn it back off here, because if not, everything's gonna leak out into your bag, okay? That's the 3 major things that you're gonna do. All right, my time is up monitoring all of that. I'm going to turn it back off to the transducer to continue draining my patient for the next hour. All right. Now let's say we need to go to MRI, or I'm in the ER and I need to go to the STICU, or I need to go somewhere with my patient with an EVD. You never want it open to the drain when you're transporting a patient. All right. You have big chance of over draining, and over drain kills the brain. So anytime I transport my patient with an EVD, I turn it off to drainage for a couple of reasons. One, I'm not going to inadvertently drain too much. And another reason is that I can get an ICP reading as I'm transporting. So if I'm in MRI, I can actually hook it up to the dash monitor and make sure that I get those ICP readings the entire time. All right? And that's basic management of your EVD. Thank you.